Hello, I'm Dr. Amana Nasir, one of the Pediatric Gastroenterologists at Mercy Children's Hospital, St. Louis. And today I would like to share some information on food protein-induced enterocolitis, a mouthful, basically implying a food allergy. Pediatric patients, kids, present to us with many presentations of food allergy. Presentations that get more press are where you have breathing problems, you have a rash on the body, you have blood and stool, or you have the second presentation, which I'll be talking about a little bit more, is this food protein-induced enterocolitis picture. In FPIES, or food protein-induced enterocolitis, your child can have one of two presentations. They may present with this violent vomiting or diarrhea, which may need medical attention pretty emergently. And that can be a recurrent pattern with exposure every time. Secondly, children may present with a milder version where you see children exposed to cow milk proteins via breast milk or formula that is based on cow milk allergy or cow milk, and then they see this presentation of looser stools, blood and stool, rash on the body, or in the extreme cases, wheezing. Treatment is simple: exclusion of these offending agents. However, as simple as it sounds, arriving to that conclusion may take a little investigation. So if I am a daycare provider, if I am a teacher, if I am a grandparent, an aunt, uncle, or a parent taking care of your child, things that we may see would be the vomiting, the diarrhea, or behavior changes in some cases. And attention to that is needed promptly because the body may go into a shock-like condition. Shock because this allergen it's receiving, it is trying to get rid of it. To get rid of it, the gut assists by upchucking it in the form of vomiting or diarrhea through the bottom. What that leads to is an electrolyte imbalance. You get rid of potassium, you get rid of sodium, chloride, and all of that puts your child at risk of electrolyte imbalances that can then affect your heart, your kidney, your blood pressure, and the vital organs. Thus, if you have a child that you suspect a food allergy, attention to a medical provider is pivotal. Now comes in the long run, what are the testing available? Well, unfortunately for FPIES, testing choices are limited, though we may sometimes see providers do an ATOPY test, ATOPY, or measure food allergy panels, or an IgE, which is a marker of allergy in the body through immune globulins. That may not be helpful. And we are limited to you, the provider, telling us this history that every time my child gets a certain food group, they get this reaction that we just talked about. What are the foods that are implicated? Younger the child, foods implicated are what they're getting. Most children as infants are getting milk. That milk may be breast milk, which contains cow milk, or it could be formula, which could be cow milk based. And that you can get those above reactions to. As you get to the solid food age, then the offending agents may be chicken, poultry, squash, carrots, bananas, or rice cereal or grains. Usually, your child or your child you are taking care of will not have a FPIES-like reaction to multiple foods. It is usually one class, the rice class, oatmeal, or the vegetable class, or again, things like the squash we talked about. So it is important to take that story into account, what we're hearing, and then make some guidelines for the family. When to introduce again? Most children, luckily, will outgrow FPIES by 3 years of age. How to bring these foods back? If your child is thriving, doing well, then we will suggest introducing a minuscule amount, small amount, a tablespoon, even try that at home. But if your child has been with a very dramatic course over these 3 years, even a small exposure has led to a lot of vomiting, a lot of diarrhea, recurrent hospital visits maybe, then it is best to do a challenge in the clinician's office. So that is the span of the illness that we talked about a little bit. Who are your players on your team who can help you? Your child's medical provider, pediatrician, family practitioner, a friendly neighborhood gastroenterologist, or an allergist. Together or alone, these are the minimum team players you need. And then, of course, your child's trusted caregivers, daycare, grandparents, family members, then school, teachers, anybody involved in your child's care needs to know about the illness. Refer them to the FPIES Association. Refer them to your pediatrician or your gastroenterologist to talk more about the illness so they know what signs to pick up on and what to do emergently. At the end of the talk, I would like to reiterate or reinforce the importance of early medical attention. If the vomiting and diarrhea are severe enough, then dehydration will set in pretty fast. So take your child to an ER sooner rather than later. Last but not least, let's chat a little bit about how to introduce foods for these children. So again, we know that when we are giving food to children, we have to spread it out by 3 to 5 days so that if there is a reaction, a minimum reaction in a non-allergic child, we may pick up on it. A child with FPIES or food allergies, we try to avoid that class. So if it's grains, try to avoid them. Substitute grains with another carbohydrate, maybe a potato base or another carrot based or fruit based or vegetable based carb food. And if it's a protein, then poultry should not be tried in that first couple of weeks. Maybe try beef, pork, or other non-poultry meat substitutes. For lentil, same thing. If you're having issues with legumes, then abandon that class for a little bit and play with the other foods. Then comes the question of what to do in an emergency situation. This is a perfectly reasonable time, like we have said, to call emergency services. Call 911 and get that help. For your child, IV fluids may be needed. At home, some of these children who have recurrent illnesses, we may have them set up with home health, who may go out and try to assist the family to decrease their hospital visits. But again, all of this is something a team of providers can assist you with. You are not alone with this FPIES. You are not alone with food allergies. Feel free to ask questions. Feel free to review web links and then talk to your providers. And if you have any questions, we are always more than happy to answer and assist you in making management or care plans for our children. Again, awareness is key, so spread the word, spread information about FPIES, spread information about food allergies that can save lives. Thank you. Have a wonderful day.